Okay, so the next hip motion that we're going to test is hip abduction, abduction. So you're going to stabilize once again, basically on top of that iliac crest, just to keep them from moving and rotating. And the action you're going to have, I'm going to have you do, Karen, is just to lift your leg straight like this, okay? And try not to bring it back. There you go, just up. And so we're testing gluteus medius and gluteus minimus here. They just sit basically right over the greater trochanter. So can you do that action for me on your own? Good. So try not to bring it forward at all, just here, right? Try that. Good, okay? So normal is 40 degrees. She probably has a little bit of extra. She's a pretty flexible person. But you want to watch. They'll compensate by bringing it forward into flexion or backward into extension, or they'll try and roll on you. And so you'll have to just kind of watch that. So Karen, what I'm going to have you do is I'm going to have you do that action again, and I'm just going to try and push you down. So hand placement. Go back down for just a second. Hand placement is not at the knee, but just kind of just above the knee here. And we're going to just push straight back down into adduction, adduction. Okay, go ahead and do that for me again. Try and resist me as I push down. 1, 2, 3, 4, 5. Karen's a 5, okay? If Karen had not been able to move at all when I asked her to lift her leg, then I would need to put her in gravity eliminated. Once again, I'm going to switch legs here simply because it's better for the camera, okay? So Karen, if you could turn over and lay on your back for me. There you go, your back. And scoot over as far as you can to this side. So you want to have them at the edge, because to do gravity eliminated for this, you need room for the leg to move. You would once again get a pillow or a towel. Because she's wearing pants, there's not friction here, and so it's not going to be a problem. But normally I do want you to know a pillowcase or a towel would be a good idea. So Karen, what I want you to do is, I'm going to walk you through it. I want you to try and bring your leg out. Watch that they don't rotate and externally rotate on this, but just straight out like that. Can you do that for me? Good. So Karen is able to do that. She's a 2. If she was only able to partially move, a 2 minus. If she wasn't able to move at all, I'm going to palpate just right over the greater trochanter, okay, where gluteus medius, well, and kind of just above it a little bit, maybe to where, but right here, where gluteus medius and minimus are. If I can feel a palpation when she tries to move, then she's a 1. If I can't feel anything, then she's going to be a 0.